Getting on the floor, one leg in front of the other, go down, knees on the floor, and sit down, and then lying down, get onto the side, roll over to your back. Fine. Now this first exercise that I'm going to show you is how to do a basic Pilates exercise for deep core abdominal stability. Now, one of the things that we always focus on is how the position of the pelvis should be. So look here and see the pelvis. So this is, I'm tilting it forward. So when I tilt it forward, the back arches. When I tilt it backwards, the arch is flattened. So see again, forward, backwards. So when doing this exercise, the pelvis should be in the middle, not too forward, not too backward. Imagine a glass of water kept here. So if I tilt my pelvis forward, it will fall forward. If I tilt my pelvis backwards, it will fall backwards. I need to keep the glass balanced without it falling forwards or backwards. So let me start again. So from this position, I'm just going to tilt it back a little bit, but not completely back. So that's the position of the pelvis. The second thing to remember is position of is trying to activate the abdominal muscles. So if you imagine a line drawn between the two bones over here in front, you need to imagine as if you're trying to get those two bones closer together, and while doing that you'll feel your finger, if you keep it there, you'll feel your fingers getting sucked in a little bit and you're activating the muscles over here. So once you've done number one, which is tilting your pelvis back a little bit, holding that position and then activating these muscles, you can move on to doing the exercise. So hands on the side, remember the shoulders just melt into the supporting surface. So it's not forward, not backward, it's just relaxed. So this way, in this position, you start. Remember, if you want, you can initially keep your fingers there to remind you not to move this part. Later on, when you're confident with the exercise, your hands can be on the side. So let's go on and start it. Tilt your pelvis, hold your muscles in, and you can also hold it by pulling your pelvic floor muscles. So when you pull in your pelvic floor, you can feel the muscles here getting activated. Hold that position, slide your leg and slide it back. You could wear socks if you want to help you slide better, but this is how you need to do. And while doing that, look at your fingers. It does not move at all. The pelvis remains perfectly stable. Usually, when you slide one leg, the opposite pelvis gets lifted up. That shouldn't happen. So look again. So when I'm sliding, this pelvis remains completely stable. Slide and slide back. So don't lift and keep, but slide and slide back. Again, slide, slide back. If you feel you cannot hold on this contraction position for more than 2 repetitions of the exercise, let go, relax completely, and then tilt in, pull in your pelvic floor and the deep core muscles again, and start again. As you get better, you will find you can do all the 10 or 20 repetitions whilst simultaneously holding the muscles in as you get better with your exercise tolerance.